Hi kids. To understand the pathogenesis of diabetes, we have to first understand the normal insulin secretion in our body. When you eat food, these beta cells of islets of Langerhans, they release insulin. And when you don't eat food, they inhibit the secretion of insulin. Insulin secretion happens in two phases in response to eating. First is the immediate, fast, rapid response, and the second one is the slow, sustained response. Let's see how insulin is being secreted from a cell. So glucose is entering the beta cells through the GLUT2 transporters, and then glucose is undergoing glycolysis. Obviously, Krebs cycle is involved. We are producing ATP now. Now, this ATP, this increase of ATP is inhibiting this sulfonyl potassium channel receptor. So because of this, potassium is not leaving the cell anymore. So there's intercellular potassium ions have increased. So inside of the cell has become less negative as compared to the outside. That's why there is depolarization of the cell surface membrane. Whenever there is depolarization of the membrane, the voltage gated calcium channels will open up. So that is why by facilitated diffusion, the calcium ions will move into the cell. And this increase of the calcium ion causes the release of the insulin, which was stored in the intracellular secretory vesicles. This is the primary mechanism for the release of insulin. Now, what is the mechanism of type 1 diabetes mellitus? The main mechanism here is beta cell destruction. There is absolute or relative deficiency of insulin here. So that's why these young males who have type 1 diabetes mellitus after a viral infection, they have to have insulin injections almost throughout their entire lifetime. Maybe you know somebody who has type 1 diabetes mellitus. They are usually young males and thin, lean males, and they have to have injections throughout their lives. Now, why there is absolute or relative deficiency? Because beta cells are destroyed. Now, why are beta cells destroyed? Because the beta cells have antigens on the surface of their cells, and now normally any antigens are recognized by our T cells and they want to kill them. But our own antigens, our self antigens, are not killed. This is called as self-tolerance or immunological tolerance. If you've read the chapter of immunity, you must have known this. So these regulatory T cells, they control whether these antigens need to be killed if they are foreign, and these are self antigens, these need not to be killed. But there is, in type 1 diabetes mellitus, beta cell destruction is happening because there is failure of self-tolerance. So now, why is this failure of self-tolerance occurring? Because either the defective deletion of T cells is happening. In the thymus, these T cells which do not recognize the antigens as self anymore, they are not being deleted anymore. Or the T regulatory cells are not controlling them anymore. So the eventual result is that it is autoimmunity which is happening. This is thought to be an autoimmune process. Now coming to the pathogenesis of type 2 diabetes mellitus. Now this one is a little bit complicated. The primarily metabolic abnormality here is insulin resistance. Although it is type 2 diabetes is occurring as a consequence of series of pathological events, but which will make him vulnerable to disruption of the homeostasis of glucose. But in mostly, insulin resistance is the leading problem. Insulin resistance is compensated by increased insulin secretion by the body, by the beta cells, which allows glucose metabolism to become normal. But in genetically susceptible individuals, these beta cells after a while become impaired. They become exhausted, leading to delayed and insufficient insulin secretion. Now, due to this decreased beta cell function, the individuals who have insulin resistance, first they develop postprandial hyperglycemia, and after which they develop fasting hyperglycemia. And this chronic hyperglycemia further suppresses their pancreatic beta cell insulin secretion because there is constant hyperglycemia, and that will worsen the insulin resistance. So the insulin resistance, then insulin deficiency, and then even glucotoxicity. These are the three problems that are happening, and eventually obviously beta cells are destroyed. That was a simple explanation. Now we will discuss it in little detail. Now, what is insulin resistance? Insulin resistance is basically the tissues which are sensitive to insulin, which respond to the levels of insulin normally, they're not responding anymore. And the three main tissues that are involved are liver, skeletal muscle, and fat. Now, liver is producing glucose via gluconeogenesis, and that is inhibited whenever we need it to be, and that failure of inhibition is occurring, so which is leading to high glucose levels. Normally, after a meal, skeletal muscle is also uptaking your glucose and producing glycogen. That is also failed. That uptake is failed. And lipolysis is happening because of lipoprotein lipase, which is in adipose tissue, which is causing the release of free fatty acids in circulation, which they also amplify the state of insulin resistance. Now this lipoprotein lipase is not being inhibited. There's failure of inhibition. So these are the three tissues which are responsible. Now genetically susceptible individuals, or for example obesity is probably the most important factor which is correlated with insulin resistance. The risk for diabetes increases as the BMI increases. It is not but the effect on insulin sensitivity. So central fat is considered to be more linked with insulin resistance than peripheral fat. Okay. So there are free fatty acids, there are adipokines, and there is the role of inflammation. We know that people who are obese always have chronic inflammation in their body parts. So these three are contributing. I'm not discussing them here. So this insulin resistance is happening, but beta cells are still trying to respond. They are still trying to. So initially there is hyperinsulinemia. The cells were not, the insulin sensitive tissues were not responding to insulin anymore, which was insulin resistant. So beta cells are producing more and more insulin in response. That is hyperinsulinemia. But after a while, beta cell get exhausted, because there is still hyperglycemia also is happening, by the way, because those tissues are still not responding to glucose. They are still not uptaking, skeletal muscles are still not uptaking that glucose, and gluconeogenesis is still happening in liver. So now beta cells are exhausted after producing insulin for producing the state of hyperinsulinemia for so long. The beta cells are exhausted, and that will lead to insulin deficiency.